Assalamu alaikum. We'll start with the clinical case. Mrs. Jane Brophy, 64 years, brought into the emergency by ambulance 2 days ago with collapse. We'll start in seconds. Okay, ready. Here you go.
Hello, I'm Dr. Ibrahim, one of the doctors in the medical unit. May I confirm that you are Mrs. Jane and you are 64 years old?
Yes, doctor.
Mrs. Jane, we are here today to discuss your health condition and to examine you. Is it okay with you?
Yes, please.
Okay. It came to my knowledge that you came 2 days ago to the emergency department with collapse. Can you tell me more about what happened?
Yes, doctor. This happened. I don't know what's happening with me. I was walking in the shop with my son, and suddenly I become breathlessness and I have chest pain, and I collapsed.
Okay, I'm so sorry for what happened to you. And this is the first time to collapse like this?
Yes, this is the first time.
Okay. And what did you feel before this collapse? You told me you felt chest pain.
Yeah.
Can you tell me? Yeah.
Yes, I felt that I couldn't breathe, and also I felt I couldn't breathe, and I found myself on the floor.
Okay. And how did you feel now? How do you feel now?
Yes, I'm feeling well now, but I'm concerned about what's happening.
Okay. Okay, it's good to hear about that. Okay. And regarding just the chest pain which you had, is it like in all over your chest or specific part?
Yes, it's more in the middle of my chest. I'm feeling chest discomfort and tightness.
Okay. And was it there for how long?
I think for maybe 10 minutes, and then I had this collapse.
Okay. And this pain, it was radiating to somewhere?
No.
Okay. Is it like crushing pain or
like tightness?
Tightness only, okay. And how much you will give me the score for the pain from 0 to 10?
It was about 7 or 8.
Okay, I'm so sorry for that. Was it associated with any sweating?
No.
And you had also breathlessness, right?
Yes.
Okay. And any cough that time?
No.
You had any cough before?
No.
Okay. Okay. And before that, have you ever heard, complained of breathlessness?
Yes, I feel that I start having gradual worsening in my breath, especially on exertion, over the last 6 months.
6 months. Okay. Okay. And that it was an attacks also, or
No, when I'm
only
doing
with exertion?
only on exertion.
Okay. And during night, you need to raise the pillow
Yes,
during sleeping?
Yes, I started to use sleep pillow to have some sleep.
Okay. And have you ever woke up at night gasping for air?
No, I didn't wake up at night for that, but I'm feeling breathlessness only.
And the chest pain, it was the first time?
I think I felt this chest pain, but it wasn't severe as this time. I was having but it was once I was having some work at home, and then I found this chest pain. It came one or twice when I was doing cleaning the house.
Okay. And during your collapse, anyone witnessed that?
Yes, my son was with me.
Okay. Do you have any shakiness of your body?
No.
Okay. Any okay. For how long you lost your consciousness?
It's about maybe 2 minutes or 3 minutes.
Okay. And how did you gain your consciousness?
Yes, my son was clapping on my face and moving me, and then I waked after that. So this is what happened.
Okay. And did they check your blood sugar that time?
No one checked my blood sugar.
Or blood pressure?
No.
Okay. And in the hospital, did they do any test for you, like heart tracing?
Yes, I think they did for me some tests, but no one told me about what is going on.
Okay. And they discharged you immediately after that?
Yes, they asked me to be followed with my heart doctor.
Okay. And did you complain of heart racing before?
Yes, I have a myocardial infarction, and I was diagnosed with myocardial infarction 5 years ago, and they did for me a stent. I have to stent in it, and the doctor gave me a blood thinner for 18 months, and now he told me to stop it, so I stopped this medication according to my heart doctor.
Okay. Do you remember what is the name of that medicine?
Clopidogrel, I think.
Clopidogrel. Okay. And you, when did you stop this medicine?
I stopped it after 18 months. The doctor told me no need
After 18 months. So after 18 months from 5 years. Okay.
Yeah.
And you are taking any other regular medications?
Yes, I have a list of medication I will tell you about.
Okay. Can you show me? Oh,
I'm
okay.
taking and I'm taking Lol, Ramipril for my pressure, and metformin. But this metformin, I'm not taking it now, because my blood sugar is controlled. I'm taking also furosemide, and also pravastatin, and also the doctor gave me a painkiller because I was having some joint pain, paracetamol, PRN, for my joint pain.
Okay. Okay. And so you have other condition that myocardial infarction?
Yes, I told you I'm having a diabetes.
Okay.
Now it's controlled on diet.
Okay.
And now it's
Did you? Oh,
and high cholesterol.
okay. And did you stop metformin from yourself, or the doctor stopped for you?
Yes, the doctor told me my sugar is controlled and I can continue control it by diet, and I'm doing that. So my blood sugar is controlled now.
Do you remember how much was the last, like the test for the last 3 months?
Yes, I think it was 5.6.
5.6. Okay. And do you have any problem like frothy urine?
No,
Any problem like blurred vision in your eyes?
no.
Okay. Any pins and needles in your foot or hands?
No, I checked with the eye doctors for my diabetes, and he told me last time that I don't have anything in my eyes.
Okay. And you are regularly following in the clinic regarding your high blood pressure and high cholesterol?
Yes, I'm following with my GP.
Okay. Do you have any swelling in your legs?
No,
Okay. Um, okay. Do you have any joint pain? You told me you have
I
joint pain, right?
having joint pain in my arms, but this was doctor told me it's mild wear and tearing because my age, and I'm taking for it paracetamol, and it's not bothering me.
Okay. Any back pain?
No,
Any mouth sores?
no,
Any sores in, sorry to ask you, any sores in your private area?
no,
Any difficulty in swallowing?
no,
Any red eyes?
no,
Okay. Any change in your waterworks?
no,
Any tummy pain?
no,
Any feeling sick or throwing up?
no,
Any change in your bowel habits?
no,
Okay. Do you have any raised body temperature?
no,
Any headache?
no.
Any tiredness?
Yes, I'm feeling when I'm this shortness of breath is I'm feeling tiredness with this shortness of breath.
Okay. And this tiredness all over the day?
Yes, since I'm started to have shortness of breath, 6 months, maybe the last 6 months, I'm not feeling myself.
Okay. Do you have any history of long travel?
No,
Okay. Do you have in your family any history of blood clots or stroke or any problem, similar problems?
yes, my father was having stroke when he was 17 years old.
70?
That's
Oh,
what I it's normal to his age.
okay. And do you smoke?
Yes, I was smoking, and then I stopped, and my husband died 2 years ago, so I returned back to smoking.
I'm so sorry for that. How many cigarettes over how long?
Yes, I'm smoking about maybe more than 10 cigarettes per day. I was smoking for 15 years, and I stopped it and it back.
Okay, I advise you to stop smoking because it's not good for your health and can help you in this regard. Do you drink alcohol?
Yes, I'm socially. I'm drinking about 10 units per week.
Okay. What do you do for living?
I'm a retired teacher.
Okay. So I can examine you?
Yes, please.
Okay. I would like to check blood pressure, pulse.
The blood pressure 140/90.
Okay.
The pulse is regular, but small volume.
Small volume. Okay. Then I'll go and check the carotid. Any
Nothing.
problem?
Nothing.
Nothing. Okay. And I'll check the heart sounds.
Heart sound. You'll find the patient has. You will hear a systolic murmur all over the
Ejection.
ejection. Yes, all over the
Oh,
heart. In second.
okay. 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 I'll check the GVB. Normal.
GVP normal, but the murmur radiating to the carotid.
To the carotid also. Okay. Then I'll check the lung. Any basal crepitations?
Nothing.
Any lower limb edema?
No.
Okay. Then I'll check I should check for diabetes also the sensation.
No peripheral neuropathy.
No peripheral. Okay. Then I'll also offer a random blood sugar and ECG for the patient. Okay. What else? Okay. Then I'll check for pronator drift also. Any problem?
No.
Okay. Um, what else? Okay. Do you need any help? You are socially supported?
Yes, I have my kids with me, and they are helping me with everything. I have good support family.
Okay. May I ask you, do you take any replacement for your hormones?
No.
No, you never took. Okay. Do you take any over-the-counter medications other than paracetamol?
No.
Any herbal remedies?
No.
Okay. Okay. Then what's your concern?
I'm concerned about having another heart attack.
I appreciate your concern, Mrs. Jane. Mostly, one heart attack is one of the possibilities, but there is another possibility with the higher chance. It's like problem in one of the like the valves in your heart, in between your the chambers of your heart. It's called aortic stenosis. Which cause the symptom which you have like breathlessness and
2
chest
minutes
pain
left.
and also the fainting. So now we need to admit you because you have severe one, and we need to run some tests for you. We need to run some scanning for your heart. And we will involve also the heart specialist to make sure what is the next step in your management. Is it okay with you?
Okay, doctor.
Okay. May I ask you, do you drive?
Yes, I'm driving.
Okay. I would like to tell you that driving now is dangerous for your health and for others. I would like to also to ask you to stop driving till we assess you and know how is the situation. Is it okay with you?
Okay.
Okay. Do you have any other concerns?
No.
Okay. Thank you.
Still one
1
minute.
minute.
Yeah, if I ask you regarding hair medication, will you stop any medication or you adjust or you modify?
She's taking, I didn't hear actually some medication in the beginning. Aspirin, ramipril, metformin, furosemide, something else is there, and statin. She's taking
And
something else?
bisoprolol, rovastatin.
Yeah, I rosuvastatin? Oh, okay. I
What?
want to
Yes.
I want to stop beta blocker.
Are you sure?
صح؟ لا رامبريل.
Yeah, any
Beta
diuretics
blocker.
or nitrate or
Diuretic.
dilator?
Diuretic. Yeah.
Yeah,
Any
any
vasodilator.
diuretics? Yes.
Yeah, any
Any
vasodilator.
vasodilator? Yeah. Okay,
Orphanamide.
perfect. Let's go to the examiner question. You can
Okay.
start.
Okay, so because I have a lot of questions. So what is your diagnosis?
My diagnosis is aortic stenosis, mostly because of aortic sclerosis. You want differential?
Yes, what is your diagnosis and differential?
The differential mostly cardiac causes like angina or acute coronary syndrome, pulmonary embolism. Yeah.
Okay, and what you do investigation for this patient?
I will do basic investigation, CBC, CRB, ESR, INR. Then I will do also for her ECG, echo. We may need angiogram also or CT coronary angio. We'll do also fasting blood sugar, hemoglobin A1C, lipid profile. Yeah, that's all.
Okay, and what is the finding that you might expect in the ECG of this patient?
The finding in aortic stenosis could be like if there is left ventricular.
Yes.
I'm not sure. Left ventricular failure.
Yes, perfect.
Yeah. Okay. We'll find the QRS elongated. I'm not sure what else. Okay.
So what are the signs of severe aortic stenosis? The clinical signs.
The clinical sign, syncope. This is the worst sign, indicating bad prognosis. Okay, and signs of pulmonary hypertension or heart failure. Okay, and also clinically, you mean with the test also?
Yes.
If there is.
I'm not asking about the echo finding. I'm asking about clinical only.
Yeah, pulmonary hypertension or heart failure.
Okay, and what is the complication of aortic stenosis?
Complications? Yeah, heart failure, pulmonary hypertension, infective endocarditis. Yeah, and arrhythmia, syncope. Yeah.
And how would you differentiate between sclerosis and stenosis?
In sclerosis, the murmur is not radiating to carotid, and but in stenosis will be radiating to the carotid.
Okay.
And old age also in sclerosis. Yeah.
Okay, and can you tell me also what is the indication of surgery?
Indication of surgery if there is severe symptoms or there is asymptomatic, but the patient developed abnormal blood pressure change with exercise, or if there is ventricular tachycardia, or there is if there is there's something else, but I forgot.
And what is the medication contraindicated with aortic stenosis?
Yeah, vasodilators and this one diuretics.
Diuretics. Okay. Okay. So, and the last thing, what is the treatment option for this patient?
Treatment option are pharmacological, explaining to the patient counseling and education about his condition. Avoid stop smoking, avoid heavy exercise, and pharmacological. Mainly, it's valve replacement if it's severe or indicated of the surgery, or transcutaneous valve repair. Okay.
And to the TAVI, the
TAVI.
transcutaneous. Yes. Why? What is the indication of that?
Indication if the patient is old age, not fit for surgery, or he has multiple comorbidities, not fit for surgery, or not fit for, if it's mechanical valve, not fit for anticoagulation.
Okay, good. Okay, you did it well. It's this station. I think it's morely by detecting the murmur and.
Dr. Sarah,
Yes.
please, one more question.
Hmm.
What would a definite treatment or symptomatic if the patient is symptomatic?
Definite treatment is surgery.
Yeah, you mentioned the options.
Yeah. All the
Okay.
option, yeah. Valve replacement, I said it's the main treatment.
Other option?
Other option, it will be transcutaneous valve repair, TAVI.
Yes.
Or,
Okay.
yeah.
Yeah, the TAVI, yes. The TAVI is the new technique now. Okay, sorry,
Yes.
Dr. Sarah, to interrupt you. Now you can comment.
Okay, so you did it well. You examined. You took a good history. Okay, but you can offer ophthalmoscopy because this patient is diabetic. Okay, you need
Yes.
check blood pressure standing and lying and blood pressure on both limbs. Okay, okay, this is the issues. And I think when the examiner is telling you what is your diagnosis, you can say this patient doesn't have stigma of infective endocarditis or heart failure. So you can add it in your diagnosis. If you are not quite sure of the murmur, you can say only systolic murmur. You don't need to say ejection systolic or pansystolic.
Yes.
Okay. So this patient, you did it well. The murmur is usually has they can ask you what is why you're hearing the murmur all over the heart. You can say this is Calavardian phenomena. In the aortic stenosis, it's Calavardian phenomena. It means that the murmur is heard audible all over the pericardium, and it's and radiating to the carotid. Okay, this is the that you can hear it all over the heart. You said I asked you about the typical ECG change, so you will say I think the ECG change will be left ventricular hypertrophy,
Yeah.
block, or left axis deviation, or it might be normal. Okay. Then they will ask you what is the sign of severe stenosis. The main sign, yes, the symptoms, which is syncope, and the signs, the narrow pulse pressure.
Oh, yeah. I know it by heart, but
Yes,
I
the
feel ugly. Yeah.
soft and hard sound, heaving apex. You can also found systolic thrill or cardiac failure. Okay.
Yes, I know. Yeah.
And for the complication, you said it right. So it could be sudden death, arrhythmia, left ventricular failure, infective endocarditis, and also embolization. Okay. Then they can ask you some question. What is the cause? But I didn't ask you the cause. It could be calcified, which is all degenerative, which is the most common in old. Could be bicuspid, infective endocarditis. Okay. And the other question that I asked you about, what is the indication for surgery, symptomatic or if symptomatic according to echo finding. So you will find the ejection fraction is less than 44. The aortic valve area is less than 0.5, less than 1, but sometimes less than 0.5 centimeter square. And ventricular tachycardia, as you said. Okay. And then the other question, yes, when I ask you how to differentiate sclerosis and stenosis, you did it right. Yes, you won't feel that it's radiating to the carotid, the sclerosis. The other thing, the patient might have normal pulse character and normal second heart sound. Okay, so
yes,
so this is the two issue. It's not carotid, the pulse could be normal, and the second sound is not weak. Okay.
yes.
Medication contraindicated, yes, you say it. I think it's the ACE inhibitor and nitrate and vasodilator, so you'll stop with this patient. I'm not quite sure about the diuretic. We stop the diuretic also. I know the ACE inhibitor will stop it contraindicated, but also diuretic will stop it.
Yes, contraindication both dilator or diuretics to keep the volume. You are trying to reserve the volume because already patients having outlet obstruction. So if you reduce the volume, he will be in more symptomatic symptoms like syncope and yes.
Okay. 2 ACE inhibitor nitrate and calcium channel blocker and a diuretic. Okay. And
Okay.
operation, you said the treatment, you did it well, and you said it heavy, yes, because of high risk people, and now they are doing for most of the patient, almost all patients are doing for them that heavy. And then they can ask you what is type of valve, but I didn't ask you this question. It could be, you can say this is a tissue valve or metallic valve and metallic valve. They can ask you about the difference between both. I think you know about this.
Yeah. Yeah.
So this is the case. I don't have, this is my comment.
Yeah,
But
Okay. Thank you,
thank
Dr. Sar.
you, Dr. Sarah. Very nice case and presentation by Dr.
Yeah.
Sarah, and perfect history and examination by Dr. Maharili.
I
Both of
felt
you
I did
deserve.
very bad, actually.
No. You deserve both full mark. Really, she presented the case well, and you did the case well. So for me, you did everything in the examination. But I will ask you some question. Will you do the collapsing pulse in this patient?
Yeah, it should be done anyway. Anyhow, in the yes.
No,
think-
it's not anyhow. No, whenever you have
Really, it's not
slow, slow rising
low
pulse,
rising
or
pulse. No
yeah,
need.
or weak
Mm.
pulse, so you expect it will be low.
Yeah,
So you
I
are
they are doing it. Any patient after pulse, they are doing the collapsing
It
pulse.
should be.
I'm
Yeah,
sure.
for
yeah. Anyway, it will not be collapsing at all. In the opposite, you will not feel any
yes.
pulse because you just feel some of these pulse in the radial. This is my comment. The first thing, one question more for Dr. Maha. Dr. Maha, please, while I'm commenting, please write the case for Dr. Sarah, okay? But I will
Okay.
ask you this question first.
Mm.
If you have asymptomatic patient, but you discover aortic stenosis, how do you manage this patient? How would you
If
manage
he's
her?
if he's
Discover
asymptomatic,
asymptomatic. You
it
discover
depends on yeah.
so
It depends on the other criteria, right? This VTAC or the blood pressure on exercise.
nothing.
You
Just
mean
the
that nothing?
accidental discover in the echo. Yeah, you discover in the
Just
echo
follow
there
up.
is aortic stenosis, but excellent. So what
Yeah,
follow-up you want to do?
Echo every 6
we'll
months.
do it every 6 months. Yeah.
Yeah, yes. Even without mentioning
Mm.
duration, you can say serial echo follow-up.
Mm.
Okay?
Yes.
Mm. Yes.
And if you suspected infective endocarditis, what you will do with this patient? You suspected
Antibiotics.
signs, yeah. So you treat infective
Admission.
endocarditis.
Yeah. Admission and antibiotics.
And also for prophylactic, if you will do the medication or patient need replacement and he had infective endocarditis, also you have to educate about infective endocarditis after the replacement or changing the pulse or the valve or whatever the plan. I mean, any surgical intervention, you have to talk about infective endocarditis. Okay?
Mm. Okay.
Education,
Okay.
prophylaxis, and you know already this topic, but it's
Yes.
very common
Yes.
topic to go through it.
Yeah.
Okay, a last
Okay.
question. Target
Okay.
INR and replaced aortic metallic valve.
2 to 2.5.
2
If
to
there is
3.
no AF. 2 to 3.
2 to
Okay.
3,
If
yes.
there is
And
no
in the
AF.
mitral,
The mitral 3 to 3.5. Or the 3 to 4. Oh.
no, from,
Mm.
3 to 4.
Mm.
Okay,
Okay.
if mitral stenosis with AF,
It
also
will be
mitral
yeah
replacement with AF,
3.5 to 4.
3.5 to 4.5.
Mm.
So let's repeat it again.
4.5. Mm.
2 to 3. Sorry, I added more value. 2 to 3 in aortic, 2.5 to 3.5 for mitral,
Yeah.
3 to 4 in mixed pathology,
Mm.
mitral replacement plus AF. Okay,
Mm.
so start by 2 to 3, 2.5 to 3.5, 3 to 4.
Okay.
Clear now?
Yeah. Clear. Yeah.
Okay. Apart from this, I don't have comment because Dr. Sarah also give a good comment plus the presentation of the case. Really, it was good, and she's trying to hide what the patient have. Only I discovered the case
Yeah.
on the pulse volume, but
Yeah.
But this is good also because if you know the case, you might be distracted.
But it should be in old age with syncope. It should be one of the main possibilities also.
Yes, syncope,
Yes,
heart failure,
especially they
and
admitted him in the hospital and they discharged him without doing anything.
but she referred to cardio. Don't
Oh, she
forget
referred
this.
also.
Yeah,
Oh,
she
but not
referred
MI
here.
at least. Yes.
No, not MI. Yes, but you
Yeah.
suspect MI in the differential, and you have to
Yeah,
put
it
the
should be.
serious. Yes,
Yeah, of
excellent.
course. Yeah, of course. Yeah.
Yes.
Oh,
Okay. One more point you have to ask when she told you, doctor, I am controlled. My blood sugar, hemoglobin A1C is 5.6. What you can ask for the
if the
welfare.
hemoglobin for the welfare.
Yeah. Now the hemoglobin A1C almost near to normal and even below the target,
Mm.
right? So you have
About
to ask
her
about it.
follow up and she has any
Yeah,
symptom of
excellent. Of
of hypoglycemia.
excellent. Yes,
Mm.
this is the
Mm.
point. Because
Mm.
now she's controlled and she might have because of alcohol. And you know, the
Oh,
diabetic patient also very risky to have MI. And it will
yes,
be,
yes.
yeah, silent MI. Okay, apart from this, I don't have comment. Let's go to the second
Okay.
case.
Okay.
Any
Thank
question
you.
from others? Very nice case and presentation.
Mm.
Okay, write the
I
case
wrote
for
a case.
Dr. Snow.
Yeah, I wrote.
Yeah, I added also the apex character in the aortic stenosis will be heaviness. This
Even
is, yeah,
Yes. Mm.
heaviness.
Yeah.
This is
Mm.
missed. You have to
But I should
mention.
do full cardiac examination.
Yes, of course. What you
Of
think?
course, full. Mm.
Yes,
Okay.
full by inspection, palpation, detect the apex, the S1,
Mm.
S2 comment, and the murmur. You have to comment also about the murmur, and the murmur comment should be complete. Uh, where exactly accentuated, when, and I
Mm.
mean the relation to the respiration and the radiation or propagation. Okay, this is the comment for any murmur. Where exactly? So it's in the first aortic area, right? Second intercostal space, increased by or accentuated by expiration, right?
Yes.
And radiated to the both carotids.
Yes.
Okay. Did you write the case, Doctor?
Yes. Yes, I wrote it.
Okay, Mrs. Mona, 39 years with difficult of swallowing. Good. I'll give you 2 minutes, Dr. Sarah, then we'll start. I will read the
okay.
comment till you finish. Yes, AF, it's common to be associated with any heart disease, but more specific with mitral stenosis or any mitral disease, stenosis or regurg. But it could be an association by stress or any heart disease, ischemic heart disease. Also, left bundle, yes, could be with any new any new MI, or it could be complicated to MI before, and it will be like chronic left bundle. Or as Dr. Sarah said, it might be axis deviation. So all types of arrhythmia here should be screened. Could be AF or supraventricular, I mean, or ventricular. AF alone, one of association, yes, I mentioned, and displaced in heart failure, the apex, yes, of course. Pulmonary hypertension could be association also, she mentioned. Small volume, no collapsing, yes. In the past test, they are doing collapsing pulse, yes, for all patients they are doing. But it's not logic, yes, you're right. So in the exam, they are following the practical, not past test. If you didn't do, you can explain to the examiner.
think it here all the trainee when they are doing
Yeah.
collapsing pulses, and me I didn't felt it in my life.
Yes, you will. No, you will feel it with the aortic regurg. Definitely, it's obvious. And you can feel the pulse, the collapse by 3 fingers even.
Hmm.
But in
But
aortic
it
stenosis,
should be
no.
also a double mitral valve lesion, and but it will be
So
according to the dominant one. The
yeah, the
dominant.
predominant, yes, the
Mm.
predominant
Mm.
one will detect or will determine what will be the pulse character. If the stenosis is most dominant, so you will feel small volume pulse. If the regurg is the most dominant, so you will feel wide pulse, wide pulse, yes, wide large pulse volume, and collapsing pulse. Differential diagnosis here, as Dr. Maha did, she said, first of all, aortic stenosis and MI. Also, you can put as a differential of chest pain like PE.
Yes, P.
So you have to mention the serious and to roll it out. Whenever you have chest pain in the scenario, roll these three causes first: MI or PE or valve disease. You can also suspect pneumothorax, but in certain cases like Marfan or smoking patient, COPD patient, pneumothorax one of the serious also complication and differential.
Okay. We can have the. I think, I don't know. It's difficult if you have the exams mixed valve. It will be difficult station.
Yes, unfortunately, but at least you will define one of them. If you identify one, you will get the full mark. Not
Really?
full mark, but you will get the mark. But if you fail both, you will fail. They will give you a very low mark.
Yes. And they told me also if you don't need to say ejection systolic or systolic, you can, if you are not quite sure, say it's systolic.
Yeah, better to say systolic only or ejection or yeah, systolic only, and then you can give differential for the systolic, like mitral regurg, aortic stenosis,
Yes.
VSD, or whatever. But believe me, one lesion they can give you the mark. For in my case, it was a case of it was a replaced mitral valve, and some cardiologists in the station said there was pulmonary hypertension. I didn't mention pulmonary hypertension at all, and I got 18 out of 20. So because of mitral valve replacement, the association, the complication, yes, you can go through the details and the discussion, but you have to specify the lesion, and they are giving one diagnosis. If both, they can give you the mark for any of them.
Okay.
You start to do full examination. If there is no finding, examiner will tell proceed. Yes, okay. Let's start. Dr. Sarah, ready?
Yes. Yes. Hello.
Yes, you can
Hello.
go.
My name is Dr. Mahmoud. I'm one of the doctor here in the clinic. Am I talking to Mrs. Mona?
Yes, doctor.
Can you confirm your age for me, please?
I'm 39 years old.
Okay. How I can help you today, Mrs. Mona?
Yeah, doctor, for the last 1 year, I'm suffering from difficulty in swallowing. So I came to know, doctor, what is the problem exactly?
I'm really sorry about that. It's look quite distressing for you having this difficulty in swallowing, but
Yes, doctor.
right thing by coming here. So I would like to have a chat with you to ask you about some questions, and then I will examine you, and at the end I will address your concern and we'll get the bottom of this. If it's that
Okay. Yeah, sure, doctor.
okay. So can you tell me more about this difficulty in swallowing?
Yeah, doctor, for the last 1 year, I have difficulty in swallowing, and I suffered a lot. So I'm worried, doctor. Is it something serious or what?
Okay, and this difficulty of swallowing started suddenly or gradually?
Gradually.
And is it associated with pain?
Pain? No, doctor.
Okay, and it's more to solid or liquid or both?
It's for solids.
For solids. Okay, and mean by difficulty in swallowing that the food is stuck in your food pipe or is
Yeah,
it
I feel it's stuck, doctor. I need to drink some water to make it swallowed.
okay? I'm sorry about that. And I just want to ask you some yes or no question if you don't mind.
Sure.
Okay, did you have any fever?
No.
Have you noticed any change in your weight?
Yeah, doctor. I lost during the last 1 year. I lost around 5 kg.
5 kilo, and this was intention?
No, doctor.
Have you noticed also any night sweat?
No.
No night sweat. It's only gossip. And have you noticed any change in your voice also, or it's only difficulty in swallowing?
No. No change in the voice.
Okay. Any joint pain?
Yes, all over my joints. I feel some joint aches. Yeah.
You feel joint aches, and since
Yeah.
when joint aches?
Also for the last 1 year.
And it's all over your joint.
Yes.
And this joint pain, you notice that it's more in the morning, related to specific time of the day.
No specific time or not related.
Any morning stiffness of the joint?
No.
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 Okay. Swelling or redness of the joints?
No.
No. Have you noticed any change in your skin?
No.
Any rash?
No.
Any change on your vision?
No.
Any gritty sensation in your eyes?
Yes.
So you also have a gritty sensation. Can you tell me more about this?
Yeah, also, doctor, for the last year, I have this gritty sensation in my eyes. I feel it's dry.
You feel it dry. And
Mm. And what?
any redness in your eye?
Sometimes.
Okay. And any mouth sore? Any mouth sore?
Sometimes, doctor. Yeah.
Some mouth sore.
Not now. Yeah. Sometimes only. Because I feel my mouth is dry.
Your mouth is dry. And also, you notice any sores in your private area?
Yeah. Not sores, but I feel it's dry.
You mean, okay,
Mm.
in your back passage or in the vagina?
And what do you mean by vagina? I'm in my private area, doctor.
Private area. Okay, sorry. Private area. Okay.
Okay.
And you told me redness. Sorry. Okay. Can I ask you some question regarding your lifestyle?
Yes, doctor, sure.
Do you smoke?
Yeah, I'm smoking.
How many cigarettes per day?
Around 10 cigarettes every day.
So I just want to advise you that smoking can affect your swallowing, and can affect also your health. So if you don't mind, I can book for you with the smoking cessation clinic. They can help you with that.
Okay.
Okay. And what about alcohol? Do you drink alcohol?
No.
And have you noticed? You told me there is no change in your weight, right? Okay.
No, I told you, doctor, I lost weight.
Oh yes, you told me this.
Mm.
Okay. And what do you do for a living, Mrs. Mon?
I'm housewife.
Your housewife. And how this condition affecting you?
Yeah, doctor, I feel it's affected too much, doctor.
Okay. I will help you with that, and hopefully we'll get the bottom of this, and we'll try to relieve your symptoms. I would like to examine you, but just another few questions regarding your health. Have you noticed any sweating in your skin?
Any sweating?
Yes.
No. No.
Any hot facing?
No.
Any change in your bowel habits?
No.
Any change in your water work?
No.
Okay. Okay. So I would like to examine you now. Okay. So
Okay.
check the vital signs.
Okay. Normal?
I would like to check the neck. Any lumps or bumps?
No.
The thyroid gland is normal.
Normal?
Okay. Any lymph nodes?
No.
No lymph nodes. Okay. I would like to check the eye for the dry
Eye redness. There is redness.
redness and the visual field.
Normal?
No. Okay. And I would like to check the mouth for the ulcers.
No ulcers.
No ulcers.
There is only cracked tongue.
Cracked tongue. Okay.
Mm.
I would like to examine the chest and heart for any murmur or chest for crepitation.
Normal?
No crepitation.
No.
I would like also to check the joints of the hand and the leg. Any swelling?
No swelling.
Okay, so what is your main concern, Mrs. Mona?
Yeah, doctor, I'm concerned what's the cause of this difficult swallowing. Do I have cancer?
Yeah, I really appreciate your concerns, but cancer could be one of our differential, but I need to run through some investigation in order, because I have many things that run in my mind about the difficult swelling that you have. So I would like to to run for you some investigation, and I will come back to you with a management plan. Okay.
Is it curable, doctor?
I think I would like to do I'm not quite sure what exactly you have, because you might have a condition that affecting the swallowing and affecting the eye. Could be an immunological condition, by meaning that your body is attacking itself, and also I need to exclude cancer. According to that, I will give you the management plan and if it's curable or not.
Okay, doctor. Okay. Is it something like related to my mother's problem before she has something like rheumatoid arthritis? It's called. It could be something like that.
Yes, I forget to ask you about the family history. You told me your mother has rheumatoid arthritis, right? It could be
Yes.
causes. That's why one of the rheumatological conditions. That's why I told you it could be one of the immunological conditions. That's why I need to run some investigation for you. I don't know.
Okay, doctor.
Okay. Still,
You are done, doctor?
I got mental block. Okay,
Oh my God. Again,
No,
Dr.
why?
Sarah?
What?
I got mental block.
Please, okay, just hold on.
Relax and very, yeah.
Okay, just relax and think about your differential in this patient and try to roll out whatever you want by question. Okay, I try to make it easy or not easy as much as I can. What
Yes.
you missed in the differential in this patient, try to go through it from now. You have still 6 minutes. What you want to ask if you want to roll out other differential?
My differential, I think I need to rheumatological condition, systemic sclerosis. So I need
Excellent.
Okay, go ahead. Go
Go
ahead.
ahead.
Stop.
Exactly.
Yeah.
Yes.
for tight skin. Any tight skin?
No.
No tight skin. Okay. And she has difficulty in swallowing, and also I need to exclude Sjogren syndrome.
Okay.
But she has mouth ulcers and she has redness in her eyes and dryness. So and Sjogren syndrome, I think the patient might have overlapping connective tissue.
Continue your history. Continue, like complete your
Okay. Any
other
recent
questions.
travel?
No, doctor.
No. Okay. Can I ask you, anyone in the family has the same condition?
My mother has rheumatoid arthritis, doctor.
Rheumatoid arthritis. And how is she doing now?
She's fine, doctor. She's on medication.
That's good. Okay. And have you noticed any rash around in your face?
No,
Any fracturing?
no.
Okay. So I think this is my differential. I'm stuck.
This is your best different. Okay.
Allah, I
This
know.
the best I can do.
Sometimes I have this block. Sometimes I'm
No,
getting.
no, that's why you are
No
trained
worries, no
here.
problem.
Yes.
Yes.
Okay. Start comment. Examiner question, Dr. Maha. Then we will comment later.
Okay. What's your differential diagnosis?
So for this, I examined this lady. She's complaining of difficult swelling with dryness eye and dryness in the vagina, and she also, I think, she's complaining of abscess ulcer. So my top of differential is rheumatological condition. It could be Sjogren syndrome or overlapping, and also she's having joint pain. So it can have mixed connect overlapping rheumatoid arthritis and Sjogren and syndrome. So and also she has also history of loss of weight. So on the bottom of my differential, I can add um, cancer, thyroid cancer. Otherwise, on examination, I didn't appreciate any positive signs apart from the carotid tongue, and that's it.
Okay. What other rheumatological diseases you can find with this patient? You need
Yes,
to exclude.
I need systemic sclerosis, um, um, Sjogren syndrome, Behçet syndrome. No, systemic sclerosis only. One of the rheumatological condition, and Sjogren and rheumatoid arthritis.
Okay. And what else? Any other things?
Are the
You
same
don't remember?
In the
Oh,
different,
okay.
also it could be the patient may have thyroid, so I need to exclude it.
Yes.
Yes. He might have, it could be also difficulty swallowing due to candidal candidiasis, but no, there is no relevant information from the history and from my examination.
Okay.
An HIV infection or some opportunistic infection. And also, yes, also other, this is my,
Okay. What is the investigation for this patient?
yes, for this patient, I would like to do for her full blood count, pool, anemia, renal function, and liver function. I would like for her a chest X-ray to exclude the retrostal, any mass compressing, and interstitial lung fibrosis. I need also to rule it out. And I need to do specific tests, autoimmune screen. So I would like to do autoimmune screen for systemic sclerosis and rheumatoid arthritis, and also dermatomyositis. It could be one of the differential, but the patient doesn't have a skin lesion or heliotrope rash. So
Okay.
I need to do the full autoimmune screen, including anti-sclerodermia, anti-sclerodermia, and anti-centromere antibody, ANCA, and rheumatoid factor,
Do you know the specific antibodies for Sjogren?
anti-Ru, anti-La.
Yeah. Okay. Excellent. Okay. What any specific test do you know? Bedside test for this?
Saliva pilocarpine. I'm not quite sure.
From the eye, from the tears?
Yes, I forget the name. Lacrimal
Shimmer test.
shimmer test.
Yeah.
Yeah, shimmer test.
Yeah. Yeah. Do you have any idea about any associated cancer? It could be with the Sjogren. Please breast.
I don't know.
Lymphoma. Okay. How you will manage this patient?
For this patient, for managing this patient, I need to. I will manage her in a multidisciplinary approach by including the rheumatology team and rheumatology doctor and physiotherapist, occupational therapist, and specialized nurse.
Okay.
By this is management. So she might start after confirming the diagnosis. We might start for her treatment. Immunosuppressive therapy, as I think azathioprine or methotrexate. Not quite sure.
Okay. What is any specific thing for the eye?
Yes, pilocarpine for the eye dryness.
Okay. And you don't know any specific medication for the
Program?
treatment itself?
No.
Okay. Thank you, Dr. Sarah.
Okay.
Okay,
أنا
can
أقفلكوا الستيشن.
well done
Well
دكتور
done.
سارة. Yes, okay. Well done
هي بس
in the
كده مايند
discussion.
بلوك، بس هي انا عارفه ان هي عارفه الكيس يعني.
Yes, of course. I will, we will give comment now. Dr. Maha start, then I will comment.
Okay. First of all, Dr. Sarah, I think you catched the diagnosis of Sjogren, I think, from beginning, right?
Yes, I catch it.
Yes. You asked the questions of dry eye, dry vagina, dry mouth, and the cause of mouth sores, mostly the mouth dryness also, the cause of difficulty of swallowing, also the dryness of secretions. So you need to exclude this is primary Sjogren or this is secondary Sjogren, okay? So you need to ask about 4 things in the beginning. Rheumatoid arthritis by the morning stiffness and swelling, of course, and everything in the joint. The systemic lupus, you will ask about hair loss and skin rash on sun exposure and mouth sores, okay? Then systemic sclerosis, the tightness of the skin and difficult swallowing, and myositis, pain on touching your muscles, okay? And ask also about the problem in combing hair, climbing stairs for the proximal myopathy, okay?
Yes.
Then you will go to the other association like Raynaud's. You will ask about hand pain and color changes on cold exposure, antiphospholipid, any previous abortion. You missed all the female history also.
Yes, I wrote it. I'm also female history. I got it. Yes.
Yeah, no problem, no problem. And you need to exclude also the other complication like pulmonary hypertension, pulmonary fibrosis, the cough. You didn't ask about any cough, chest symptoms or heart. I think heart also you missed.
Facing
You
on-
asked it?
Mm.
Yeah. Then also the other GIT, I think you asked about them. Okay. Then lower limb edema, fever you asked. Then also you need to ask about driving. He told you that he has sometimes dry eyes and there is redness also in the eye. So maybe he has some corneal opasitis or something. You need to make sure of the visual acuity while examination and check if the patient can drive. You didn't ask also about driving. Okay. And for the examination, you did well in the examination, but you need also to examine the eye, like visual acuity, and check for any corneal opasitis with the torch. Okay. Then also, what else? You need to check, of course, the hairline to check for systemic lupus. Check all the sites for the rashes, the hands. Yeah. And regarding investigation, you did well. All the rheumatology panel you need to do to exclude and anti-Ro, anti-Law, as you mentioned. And regarding the treatment, as you said, mostly nothing to add. There are some medication can help, like azathioprine or the DMARD. Sometimes they are giving steroids. Sometimes for the vaginal dryness, you need to give some lubricants and artificial tears for the eye dryness. And maybe it's like symptomatic and supportive treatment. There is no cure. Okay, that's all.
Yeah. Thank you,
And also
Dr.
one more thing in the examination, the parotid gland, maybe they'll have sometimes the parotid gland enlargement.
And you said primary and secondary Sjogren. Secondary, it's mean associated with other rheumatology.
Yes. Yes, in this case, there is no other association, so it will be primary Sjogren.
Okay.
Mm.
Thank you.
Okay, thank you.
Thank you, Dr. Ma. Well done, Dr. Sarah. I think after this case, you will like this topic. And you will like
Problem
what?
with rheumatology, all the rheumatology cases.
No, at all.
It's very important. Rheumatology is
Yeah.
very important. Yeah.
I did
Not
this.
only important, if you put it and you practice it once, believe me, you will be expert in.
Yes.
So what you will do, write in any rheumatological disease, start by mixed connective tissue, first differential to roll. What do you know about mixed connective tissue, Dr. Sarah?
Mixed connective tissue disease is a mix with all the many overlapping of rheumatoid.
Yeah. So what are they?
Rheumatoid arthritis, Sjogren, systemic lupus, systemic sclerosis.
Yes. Write all of them. And by every question, you have to roll one of them out. Either to be positive for mixed connective tissue, and will case will be mixed connective tissue disease. Or it will be like this scenario, primary Sjogren, isolated systemic erythematous systemic sclerosis, SLE, or it will be systemic sclerosis alone. So any rheumatological condition, you have to roll out all other association. If present, it will be mixed connective tissue disease. If not, so you roll it out by history. One also important here, antiphospholipid syndrome, history of miscarriage. Or, yeah, you have to. So again, mixed connective tissue disease, you will put it in the top of differential and to roll out one by one. SLE. What the question for SLE?
Malrash, malrash.
Excellent. Rash in the face, while exposed to the sun. This is the clear question, right? You have any rash while exposed to the sun? Yes, doctor. SLE mark. So this is positive for SLE. Not only this, you have also to ask for shortness of the urine, because sometimes you have what's called induced, not induced, it's Lupus, not
Nephritis?
no,
No.
not
Nephritis.
lupus nephritis. I mean, rash in the face, which is positive for histone,
Drug-induced?
antihistone. Yeah, drug-induced.
Oh.
Yes, drug-induced lupus.
Yeah.
Yes.
So
And
you
she
have
missed
to.
also the medical history and the all the past history.
Yeah, we are
Yeah.
trying to bring
Yeah.
it from
Yeah.
first now. Yeah, no
Mhm.
problem.
Yes, you are right. I missed
Okay,
basic.
this is the first thing. The SLE you rule it in by or rule it out by this question, either rash or shortness of the urine. Sometimes you can find also arthralgia or arthritis. This is for SLE. The next condition will be systemic sclerosis. What you will ask? Question. Give me question for. Yes, exactly.
Mm.
Tightness,
Raynaud's
sclerodactyly,
yes.
Raynaud. Exactly. All this will be with
Mm.
even CREST syndrome. You know CREST? Association of calcinosis and the dysphagia
Mm.
and Raynaud. And so this is for systemic sclerosis. Not only systemic sclerosis as peripheral signs, you have also central, or which is called diffuse, right?
Yes.
What the signs of diffuse systemic sclerosis?
Interstitial nephritis, proximal myopathy.
What else? In the lungs.
Interstitial lung fibrosis, I'm meaning, sorry.
Yeah, interstitial lung fibrosis or pulmonary hypertension,
Yes.
right? So you have to ask about short of breath or any cough. This is for systemic, for systemic sclerosis, both types. Plus tightness of the skin, of course. Next one, Jogren. What you will ask?
Dry skin, dry eye, dry mouth.
Yeah, and dry private area. Don't say you have any dry vagina. This is also one of the comment, yes.
Okay.
And Dr. Maha corrected you. What you mean? So it's private area. Do you feel it's dry or no? Okay. What else? This is for Jogren. Antiphospholipid syndrome. What you will ask?
Recent history of abortion, blood clots.
Any history, not only recent. Yeah, any history, right?
Yes.
And blood clot. Yes, miscarriage, not abortion, miscarriage. Yeah, okay, miscarriage.
Livido reticularis rash monkey.
This is the secondary, could be there, but it's not one of the definition of mixed connective tissue disease criteria. Okay, if you find all of these, plus rheumatoid arthritis, of course, rheumatoid one is important. Okay, rheumatoid, what you will ask about rheumatoid or how to ask?
Morning stiffness, more than our.
Yes, more than, yes, exactly. That's it.
Joint pain.
Yes, that's it. So you can spend 10 minutes only screening all this disease. Then the social, as we said, if family history, travel history, medical history, and HIV, but if sometimes you don't need to ask about HIV. Occupational, of course, the job, smoking, alcohol, driving, and the impact of your on your job. Okay,
Yes.
that's it. Examination, starting from the hand, you can discover a lot of things: calcinosis, sclerodactyly, Raynaud, pulse, and sometimes stiffness, deformity. All of them you have to do. Function of the joint. Okay. Even you can feel the temperature to show the examiner that you're examining for arthritis, active arthritis. Then you will go for, I forget dermatomyositis. Sorry, Dr. Sar.
Yeah.
One of the, So how to ask about dermatomyositis?
Heliotrope rash and Gotten papule.
That's it?
And also,
this is associated, yes. What else?
and also I have a proximal myopathy.
Excellent, yes.
And
Proximal myopathy or muscle pain?
Smoking due to lung cancer could be related.
Muscle pain. Okay. So this is for dermatomyositis as well. Now, if you rolled out, yes, you will go to the examination as we are starting. The proximal myopathy, after we finish the pulse and the peripheral sign in the hand, the tightness of the skin, is it below the elbow or above the elbow?
Yes.
Below the elbow will be
limited sclerosis.
limited.
Yes.
And this is positive with what antibody in the limited?
Anti-centromere.
Excellent. And the diffuse one will be positive for?
Scleroderma.
70. Yeah. Okay. Associated with diffuse, what internal organs will be affected?
Was it
As-
diffuse in the lung?
Excellent. Fibrosis. So you will examine the back
Mm.
for
Yes. Repetition.
crepitation. Corrected with the cuff or no?
No, not correct.
It will not be, yes.
No.
Okay, and if you have the limited one, what you suspect in the pulmonary examination or lung examination?
It's normal. It's Molly Crest syndrome.
No, in the lungs with the limited, what you will have?
No,
No, pulmonary hypertension.
in the crest.
Yeah, not the crest, I
Limited.
mean limited one, yes. There is a pulmonary hypertension, right?
First time I know this information.
No, it's that one is interstitial lung fibrosis, and the limited one will be pulmonary hypertension. How to do the pulmonary hypertension by
Pulmonary
exam? Yes,
loud P2.
excellent.
Mm.
Yeah, that's it. Parasternal heave, loud P2.
Mm.
And if there is heart failure, you might have also raised GVP. Then this is for the chest examination. The abdomen will be nothing there. Then you can examine the legs, the knee, I mean, for any arthritis in the knee,
Yes.
as well as in the leg. Don't forget the rash in the face, SLE rash,
Mm.
and the dryness of the eyes.
Mm.
This is
And
the case.
also, Dr.
If you,
Bassam, the proximal myopathy also, yeah, I need.
yes, did I mention or no when I said
No.
dermatomyositis? Yeah, you have
Yes.
to do proximal
No.
myopathy by your hand. Yes, you're right. Okay, doctor. So whenever you have associated condition like this, you will like the case because you will utilize the time doing all these things, and you will show the examiner by every sentence that you are asking for something. But if you have one disease, for example, single disease, you will take time, maybe not asking for something related, irrelevant history, irrelevant system review. But when you have something like this, you will ask about everything and you will impress him with every question. This is and you will like this case, believe me. If you find this case in the exam, you will do much better than what you did today.
Oops.
Okay, just remember the association.
Sorry, Dr. Bassem, for interruption. What is the cancer associated with Sjogren syndrome?
Cancer?
Yes.
Red lymphoma.
Lymphoma, parotid, yes. I think, yes.
Non-Hodgkin lymphoma?
Non-Hodgkin
It's
lymphoma.
lymphoma. I'm not sure which type, Hodgkin or non-Hodgkin. It's lymphoma.
Lymphoma, okay.
And parotid affection, one of the
Parotid
associated.
enlargement, yes.
Yeah. Okay, so a lot of question in this case, either in the investigation, in the history, in the examination, in the management, everything here. I got wallahi, I believe if you have this patient as a case in the exam, you will get full mark because you will do all these things and the examiner will need all these things from you and you will do everything. Just put it in your mind, differential diagnosis of mixed connective tissue disease. I have to roll all this out. And if you have rheumatoid arthritis, don't forget the function of the hand and fingers. It's very important. Not only look, feel, move. The function. Take this coin. Pick up this coin. Yeah. Believe me, you will get good mark. Okay. So this is the first time only, but whenever you do it again, you will be much better.
Okay, thank you, Dr. Bassem.
Most welcome. No worry. It's the rheumatoid. I know sometimes it's nightmares for some of you, but wallahi, it's nice branch. This is the top. This is the maximum complicated case in rheumatology, by the way. Either to have single or associated. So this is the associated. Whenever you do the association and you find all things, you will get the mark. Whenever you roll out one by one, you will get also the mark. I guess this patient, sorry, I said this is the maximum. No, this is the isolated Sjogren. So you have to roll out also the association. Whatever the condition, you have to roll out the others. And you put other also in the differential. So you start by Sjogren in this patient as a differential, but you put also mixed connective tissue disease and overlap syndrome.
Yes.
Okay.
Thank you. Thank you.
Most welcome. Any question? Yes, I think the question here, the comment here, interstitial lung disease, yes, rheumatoid, SLE, yeah. Someone wrote for you, the and Renaud. Don't forget the smoking advice because it's worse. The Renaud also have questions. He might ask you about Renaud. What medication you can give to the Renaud, how to give advice. It's very important, yeah, to avoid coldness, to warm the hand, stop smoking. If
Ma-
patient beta blocker, taking beta blocker, you have to stop the beta blocker. You can give him calcium channel blocker. This is for Renaud, okay? All this question related to Renaud. What you want to ask, yes?
No, I was saying that to wear mitens as gloves.
Yes, exactly. Gloves, and sometimes it will be occupational issue. Patient working with the eyes,
Yes,
ice cream.
mechanic, yes. Vibrating tool. Yes.
Yeah, I guess, Dr. Sarah, you know everything, but the mental block you have make you stop.
Yes.
But believe me, if you practice once, you will do it again in professional manner. Don't worry about this.
خلاص هم أسبوعين فاضلين خلاص. أعمل ألحق إمتى؟
No, wallahi, even one time practice, you will
انت
never
مش
forget it.
هتنسيها خلاص.
ماشي.
خلاص.
Yes, you will never forget it. After this time, you will never forget it. Just read the
I
topic
took
today.
for systemic lupus and I didn't ask for all this. It's the same mistake.
No. I give you today another lesson. Hopefully, you will learn from. Please, it's very nice case. Wallahi, like it. Try to like it. Then you will do it practically. Okay? Just read about the topic today. All
Yes.
this mixed connective tissue disease, the association, the investigation, the management, and the history taking. I give you the history, how to ask every question, and the examination also.
Okay, thank you so much.
Don't worry, Dr. Sarah, you'll do the best, inshallah.
Hopefully. Okay, thank you. Inshallah.
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 Okay. Any comment, other comment from others? Any question? Thank you, Dr. Maha, for the case. It's a nice case. Actually,
Thank you, Dr.
both cases today were nice, really. And both of you did great. Hopefully,
thank
you'll,
you.
inshallah, you will
Thank you,
pass
Dr.
both of you.
Sarah. Inshallah, you'll pass.
Inshallah.
No worry.
Okay.
Be confident and trust yourself.
Yes.
Yes.
We are supporting you till the day of the exam. No worry at all. Most
And me
welcome.
also.
Yeah, both of you, of course. But you, mashallah, Dr. Maha, you're expert, mashallah.
والله I feel myself يعني
No,
مفيش أنا حاسة إن أنا
This feeling, yeah, this feeling.
ضايعة خالص.
هو امتحانك
No, this feeling.
where is your exam?
3 أسابيع.
Okay. In Egypt or where?
No, in Sharjah.
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 Hopefully we'll do it.
Yeah,
But
Allah,
the problem, the
Bas
stress
both
in
of
the
you.
exam is horrible. The
Yes.
problem in the mental block in the exam is horrible. So hopefully, inshallah.
Whenever you are practicing more, you will never have this stress effect. You will be confident, inshallah, both of you. Hopefully,
يا رب.
inshallah. May Allah bless both of you, inshallah.
inshallah. شكرا دكتور.
Inshallah. Most welcome, inshallah.
Inshallah.
Okay, if no more question, we'll see you tomorrow, inshallah, with new session. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
عليكم السلام.